And this is one of the more interesting things that I've learned about recently, hearing you on other podcasts and talking to you, is the number of symptoms that mold can present with. It's quite varied. And there's a lot of people out there who have anxiety or palpitations, or maybe are having these attacks that may feel like PTSD, post-traumatic stress disorder, or higher blood pressures. And isn't it interesting to think that this could be mold? I mean, what's the spectrum of symptoms that mold generates in people? What is the most common? And then what other things do you see in people who are exposed to mold? These are obviously not going to be, not every person who has these symptoms has a mold exposure, but I want people to understand that there's quite a breadth of symptoms that people can experience when they are exposed to this. And it's something to think about.
Sure. Yeah. I mean, people call Lyme disease the great mimicker because it seems like so many other things, and mold is in the same category as the great mimicker. They're almost exactly the same. It could range anything from anxiety and panic attacks to depression, bipolar, schizophrenia, any sort of mood issue. If you have rage, if you're angry, if you're abusive, you probably have mold toxin. If they were to take a survey of all like domestic abusers and test their urine for mycotoxins, I'd put a huge amount of money on the fact that 95% of them are going to test positive. In fact, there was a study done by a guy named Dr. Brewer, who ran a chronic fatigue clinic for years. 95% of his patients in his clinic that had chronic fatigue had at least one mycotoxin in the urine. So I'd say fatigue is the one that most people can relate to, and we could get into the mechanisms, but mainly it's just damaging your mitochondria and it's affecting the gut barrier. So your nutrient absorption falls apart. You get candida overgrowth, which is a symptom. You get bacterial overgrowth, which is a symptom. So all the people listening, if you've been doing treatment with naturopath or functional medicine practitioners, like you're doing oregano oil and berberine and Paul d'Arco and French tarragon, and you're rotating all these antifungals and antimicrobials, but your SIBO and candida keep coming back, it's probably because you have mold. So any sort of recurrent infection would be mold. Brain fog is huge. Dizziness, I mentioned I had dizziness, tinnitus, so ears ringing. Could be full-blown vertigo. I mean, if I had a really bad hit of mold, like I stayed in a moldy hotel, you could end up spinning. So blood pressure will be unstable because it messes up your nitric oxide synthase. So you literally don't make as much nitric oxide. So for men, erectile dysfunction, weak erections, cold hands, cold feet, cold nose, circulation issues, heart palpitations, atrial fibrillation. I've seen several cases in older females who were put on beta blockers and other prescriptions by their cardiologist. Unfortunately, with finding and treating the mold, we were able to get them off their heart medication. So I think a lot of cardiologists are putting these patients on medications because they think that's the solution, but it's not root cause. As you and I both know, a beta blocker or a blood pressure medication, these diuretics, it's just managing the blood pressure, managing the heart palps, but mold was the culprit. So, I mean, I could go on and on symptoms. Anything that's weird, anything that someone would classify as a weird symptom, like you have a burning sensation in your head, or you've got tingling in your feet, or you go in a certain building and one side of your face gets numb. Anything that people would describe as weird, you could assume mold.
When people reach out to me, obviously I don't give medical advice on the internet, but when they reach out to me and they say, I have this condition, I usually direct them to Heart and Soil and have them email us at Heart and Soil. And the first thing I think of for people is start with your diet, right? Start with the low hanging fruit, like eat a nutrient rich diet, which I think you and I both agree is a lot of animal foods and organs and the least toxic plant foods. And so start there, you guys. So if you're listening to this and you have weird symptoms, start with the least difficult things to change in your life, right? Make sure your diet is on point. Maybe think about your circadian rhythms. Think about your exposure to sunlight. Get real sunlight on your skin and sleep well. So if you're doing those things, if you're sleeping well, if you're getting sunlight on your skin and your diet is on point, you're including organs, either fresh or desiccated, and you still have weird symptoms, that is the point at which we need to think about things like, I would say, mold and co-infections. Would you agree with that?
Yeah, it's huge. And the problem is people don't want to face the truth. This is one of those weird controversial subjects. I mean, I talk about all kind of controversial stuff on podcasts, but mold is one of those ones that makes people really uncomfortable. And I don't know why. I haven't figured out if it's because of the money that you have to spend on remediation, the potential to have to throw out all your stuff and give away all your clothes like we did and start all over. I don't know if it's the family members talking people out of it, saying you're crazy. I don't know if it's like a just a psychiatry type thing where they blame it on your, it's psychosomatic, right? It's all in your head. I don't know exactly. It's a convergence of many factors, but this is something people don't want to talk about. But yeah, regarding diet, that's why so many people feel better. If you go paleo, I think that's a good start. But if you go further and you go carnivore, and like you're talking about now, adding back in honey and some berries and things like that, I'm doing the same thing personally. Like I had a grass-fed sirloin for breakfast today and I feel great. Yeah. And my daughter too, my daughter Summer, she just turned 5. That kid's a carnivore. I mean, she won't eat vegetables. She doesn't want to. And after you came on my podcast, I stopped feeling guilty about it because I had this pressure, like, hey, honey, I'm going to get you to do some organic broccoli. I'm like, wow, we got to help detox, right? Let's get sulforaphane in you. Let's get some broccoli. Now I could just care less, and she performs better without it. So
how much consternation could be saved across the world in houses when parents just stop forcing their kids to eat vegetables that they don't want to eat and they don't need. Like, your kid is smarter than you. They don't need spinach or kale or broccoli or vegetables. Like, just don't force them to eat vegetables and it'll be so much better.
It's called a gravity plate. So a lot of mold companies do air testing where they just suck air out of the middle of your air column in your room and they say everything's fine, but the mold spores fall to the ground. So these agar plates have essentially a gum on them that will hold on to the spores, and then these things can start to colonize. So what we're seeing, fortunately, on the bottom picture, this is my office as of last week. Only one colony, which is considered normal, only one colony of Aspergillus showed up. And then on the top here, this is our great room. We've got a big screen room and we've got a big patio. We've always got fresh airflow. So we're probably bringing in some outside molds, which can be okay. But you can see here, you can count at least, I'm counting at least 5 or 6 colonies. So I'll probably end up using some essential oils to treat that and knock the levels down. Of course, you like to match that up to the client or the patient's symptoms. You like to figure out, hey, are you having these symptoms? So on my intake form, I have people check off all that stuff we talked about earlier. If I see or hear more than 3 symptoms, let's say it's anxiety, fatigue, and vertigo, I'm like, oh, ding, ding, ding. And then we'll just run a urine screen to confirm or rule it out. I became so sensitive to perfume and hairspray and candles and any kind of synthetic fragrance. It would almost make my eyes go blurry. So anyone who's chemically sensitive, some people say, oh, that's just my preference. Oh, that stuff's nasty. I don't like it. Yeah, I mean, these are estrogenic compounds, right? We know there's xenoestrogens. There's all sorts of man-made chemicals in these products. So that's one good reason to avoid them. But if you're having a reaction, meaning your family member comes over and the dryer sheets on their clothes makes you ill, that's a chemical sensitivity. Some may diagnose that further as what's called mast cell activation. Mast cells are part of the immune system. They have tryptase and histamine and other mediators in those. And when you get exposed to a toxin like mycotoxins, which come from mold in water damaged buildings, those mast cells start to leak out histamine. So when you hear about people with histamine intolerance or they're going on low histamine diets, that's the reason carnivore diet's so great, is because as long as you're not doing 3-day leftover meat, in general, it's a very low histamine diet, which is why I push people towards it. But it's not necessarily the histamine that's the problem. It's your tolerance for histamine that's the problem. And that's because of your mast cells. So usually what we'll do is we'll try to stabilize people and use something like quercetin, which is in the vitamin C family, which will stabilize the mast cells while we're working behind the scenes. But yeah, if they have symptoms, we'll likely just run urine right out of the gate, because if they're fatigued, we want to look at their mitochondria on an organic acids test. And organic acids are essentially like measuring your tailpipe. When you take your car in for emissions testing and they measure the pollutants from your tailpipe, you could do the same thing with first morning's urine. And when you look at the urine, you can see all kind of stuff, which we could get into, anything from bacterial overgrowth to candida. Mycotoxins deplete dopamine. So we're all a smartphone, social media addicted society. I think part of it is because so many of us have low dopamine due to mycotoxins depleting dopamine. That's one of the many reasons.
3 things people can do, which I think are reasonable. You can start with Petri dishes and do just mold colonies in your house. You can do urine organic acids testing, which is something I've talked about. And you can do urinary testing for mycotoxins through a company like Great Plains. But you touched on something that I want to highlight, because I get a lot of people asking me about histamine intolerance and histamine sensitivity. And these are co-occurring things that I really want to highlight for people. And you mentioned mast cell activation syndrome, which is sometimes abbreviated MCAS, MCAS. And then you also mentioned SIBO. So I want people to understand that, like, recurrent candida, SIBO, histamine intolerance, MCAS, if you're doing everything else right, animal-based diet, sunlight, sleep, maybe this is something to think about with mold. And this could be one of one of these keys that unlocks the door for a lot of people that isn't always thought about, because you do run into people a lot of times with difficult to treat histamine intolerance. And, we have a supplement at Heart and Soil, Histamine and Immune, which seems to help because it provides some DAO, some diamine oxidase from kidney. But then the question, and thymus, then the question is, why are you not making enough, right? DAO. And that's usually a gut issue, which could again be related to mold toxins. A lot of people will rightly say mold is everywhere. We shouldn't be worried about this. We should be able to tolerate it. And I used to think that. I have some really smart friends that I respect deeply who would say that.
And the answer is yes to all of those. We certainly used to be able to tolerate it. But as you mentioned, we're in these sterilized environments now where we have drywall that has paper backing. We have very poor ventilation, and we don't bring fresh air in. With the new building codes, the houses are built so tight now that they don't breathe. Let's say under your kitchen sink, you had a leak under your kitchen sink, and that water sits there for more than 24 hours. And now you've got mold growth where you store all your hopefully healthy cleaning products. You've now got aspergillus, and that aspergillus is like, hey, this is a pretty good spot. I don't want any other molds to come in and take this. I'm going to eat this product, and I'm going to convert this wood back into soil or whatever else. So what I'm going to do is I'm going to start farting, and I'm going to fart ochre toxin. And that ochre toxin is poisonous to other molds because I don't want them coming in and stealing my food. And then Stachybotrys, the notorious black mold, can come in and say, no, this is my territory. I'm going to start emitting verrucarin, or I'm going to emit roridin. And these are different mycotoxins that they want to poison other molds. You're just the innocent bystander that happens to be in this very tightly sealed up home with drywall and tight windows and tight doors, and you don't have air purifiers, and you've got spray foam insulation. So you literally cannot get any exposure to dilute this crap. And then you breathe it in, it gets stored in your fat cells. The mycotoxins block your leptin receptors. So now you're never full. So even though you're eating all these great grass-fed meals, you never have satiety. So you run for the organic gluten-free cookie after dinner because you can't satiate yourself. It's because your leptin receptors are blocked by these mycotoxins. So you mysteriously put on 20 pounds and you don't know why. You're eating carnivore or keto and you're gaining weight and you can't lose weight. Your weight's not budging. Why? It's because the leptin receptor's blocked. So this whole cascade happens often without you knowing. And then these mold farts are just, they're out there. So you breathe them in, they get stored, and then you measure them in the urine. Luckily, you can bind them up and pull them out of the body. Yeah. So one more comment on buildings, and then let's talk about the oat, because this is important. And I think people, if they don't get this part, then everything else is useless, which is you got to get your humidity under control. In the months November through February, it's gray, it's cloudy, it's wet. There's a lot of moisture here. So whole house dehumidifiers are a game changer. So if you're going to live in a drywall box like I am, whole house dehumidifier. So that's what we have in a brand called April Air. I'm not endorsing them. I'm not affiliated with them. That's just the brand we have, and they've worked really well. What they do is they hook up to your ductwork. So in our basement, in the unfinished space, we have these whole house dehumidifiers that hook up to your ductwork. I set them to 40%. My house is perfectly at 40% humidity, never a percent higher. And if it goes a percent higher, they kick on, they suck the moisture out. It runs a tube outside of the house to drip that moisture out of the house. You can easily go on Amazon, and this would be interesting for you with your Costa Rica place. I'm sure it's like 90, but you can buy a hygrometer and you can measure humidity. And if you see that your house, which is sealed up, if it's not open air, then you're sealed up. If you've got 60, 65, 70% humidity, you've got a problem. Mold growth is inevitable. So those little like GE makes standalone dehumidifier units, but you don't want that because then you're going to argue over who has to drain the bucket of water like every 6 hours. It's going to get exhausting. So the whole house dehumidifiers, you never think about it. You set it and forget it, and your house will be perfectly maintained. Now, that doesn't fix if you have a leak. That's just for not allowing moisture to create mold. So those perfect days like today here, it's blue skies, it's like 70 degrees, but it's super humid. So it's not hot enough for the air conditioner to run, which is going to suck some moisture out. And it's not cold enough to run the heater, which would also suck moisture out. So the HVAC system is kind of in limbo right now, but it's like 80% humidity. So if that 80% starts seeping in, what's going to take care of that? What's going to prevent the 80 from coming inside and turning your 40 to 60 or your 40 to 70. So that's why whole house dehumidifiers in most of the country, in my opinion, are necessary building strategies. Luckily, the parents are wise enough to recognize his symptoms at 3 years old, and they want to get him better. So this poor kid, his name's Thomas. and he lives up in Pennsylvania. And he presented with a lot of skin issues. He had sleep issues. He had mood issues. He was angry. He was irritable. He had food reactions, food sensitivities, and we can see why. So what we're looking at are the byproducts of your metabolism. This is the exhaust pipe of the body. You measure this in the urine, and these different organic acids are linked to certain things, like this marker here. This is aspergillus. So you want less than 28. That would mean that you're not growing mold. This poor kid has been exposed, maybe from a daycare. She was exposed, and we know that mycotoxins go through the placenta in utero. So even if a child did not have their own exposure, the mother can pass these mycotoxins through the placenta. And we've also seen mycotoxins show up in breast milk. So breastfeeding is the number one most important thing you can do for your child. The unfortunate thing is, if you're full of mold toxin, you will transfer that to your baby. However, we've put even my youngest, we've put her on binders and micronized chlorella and some other things we can get into from day one. And you can detox these children very effectively. But long story short, what happened with this kid here is he was exposed to so much mold that he is now considered colonized. So there's several situations that can happen with mold. You can just go to a moldy hotel in Cabo for the weekend and you take a little hit of it and it gets in your body and that's it. And it stores and you're a mold reservoir. Or you can be a mold factory, or you can be both. In this case, this kid is both. He is making mycotoxins internally now, meaning even if his mother took him to a non-moldy house, he was living in the middle of the desert and he had no mold exposure, it doesn't matter because he's generating those mycotoxins internally now. And so you can see these levels are just off the charts. Arabinose, that's a marker for candida. So this kid has tons of candida overgrowth. He is addicted to sugar. And if you hide the sugar, he seeks it out. He's like a heat-seeking missile for sugar. I mean, he'll find it. You hide a cookie, he's going to find the cookie. And it's not his fault. It's because the candida wants to survive. So when you put a kid like this on, we'll use liquid oregano or we'll use berberine or antifungals. As soon as you put the kid on that and you start killing these mold colonies and the candida, it's going to drive up the cravings more. So it's just really up to the adult or the parent to just try to help keep these people on track with their diet to get through the treatment so that you can resolve this. And then I'll pause in a minute so you can comment on this. But the last section on page 1 here of this oak test, you can see this kid has a major bacterial overgrowth problem. And he also has an infection that we see a lot in hospitals where people go in for endoscopies or colonoscopies, routine procedures, and they come home with what's called an HAI, a hospital-acquired infection, like C. difficile, which kills a lot of people because they basically just diarrhea themselves to death. So this poor kid's got C. diff, and the conventional treatment in the gastroenterology world is very, very, very heavy-duty, strong antibiotics. And as you may have talked about before, you have this problem of antibiotic resistance. So even if you give this kid antibiotics, it might not treat the C. diff. Fortunately, with herbs, we haven't had any resistance problems. So with a combination of it, hopefully we'll kill all these bad guys, which we have a lot. We've got tons of bacteria. We've got a bunch of yeast and a bunch of mold. What do you do for these kids? And you really just have to pay attention to symptoms. And if they're constipated, we'll bump up magnesium or we'll throw in some laxative herbs. Or if he goes to diarrhea, then we just try to go heavier on the binders. Like when you see elevated liver enzymes on a blood work, that's a clue, but it doesn't really tell you why. These type of tests can tell you more straight to the source of why you may see elevated liver enzymes. So in this case, you could see like B vitamins, his B5 was super low. And then vitamin C is almost always low. I mean, he wasn't flatlined, but he was on the low end. And my thought is vitamin C being an antioxidant, the body's just going to burn up as much as it can to try to protect you from the free radical damage of the mycotoxins. But let's go over to the next one, because this is the smoking gun for people. This is the actual mycotoxin report. And so the cool thing is you can pee in a cup, first morning's urine. And the cool thing about fasting too, you're actually going to increase the excretion of mycotoxins and you're going to flush those out through your system more effectively. So that's just another benefit, another reason why many people may feel better when they're fasted, partially because they're running on ketones, but I think also part of it's because they're now flushing out mycotoxins. So these are the actual mycotoxins. So the same urine sample was run through 2 different machines. And you can see here the ochratoxin coming from that aspergillus that he's growing in his gut and probably his sinus cavities too, right? This is why we use antifungals in the nose, because you're growing it. That's how you got exposed to it. You were breathing in a moldy building. So the chances of it colonizing your sinuses are huge. When you hear ears ringing, blurry vision, those type of symptoms, we assume there's more sinus involvement. And then you can see here gliotoxin, which also comes from Aspergillus, but Candida makes gliotoxin too. This is where the brain fog comes in. You want to be less than 200. This kid's at 3,671. And I see this all day, every day. So this is not a rare occurrence. I'm not like picking a 1 out of 1,000 case. I mean, this is like every day, all day. This is what I see. Here's the bad guys, the Stachybotrys, the Roridin we were talking about, and the Verrucarin. And how do you know they're so bad? Well, look at the reference ranges. So for Roridin E, you want to have less than 0.2. So the lower the reference range, the more toxic it is. A woman who was depressed for 20 years and she got 90% better with her depression in 6 weeks, but she just had a lot of ochratoxin. You can see here she was off the charts, but everything else showed up clear. And here's the interesting thing, which is, so after 6 months, usually we'll retest the urine. We'll often see a bunch of new mycotoxins show up. Jane Doe, she's not a good excreter or detoxifier, so she can only pee out just enough mold for us to get a positive result, enough to justify using binders and glutathione to help treat her, versus somebody else may be better at flushing it out. So their urine test looks worse on paper, but they actually may not be bad as the lady who can't excrete it. But luckily, once you upregulate the pathways, you get people doing infrared saunas, you're heating up the body, you're hopefully improving diet, so you're becoming a more efficient fat burner. Your levels may go up 10 or 100x on the retest. That doesn't mean that you got exposed to more mold. That could just mean that you're getting better at flushing it out. So some of it's genetics. Like when it comes to mold, if you read any mold books, you'll hear about this gene called HLA-DR, and about 25% of the population has it. I personally don't test for it, and I don't think it's worth testing for, because if you see the mycotoxins on the urine, clearly they have a problem detoxing mycotoxins because they have a buildup. So I'd say save your money. Well, there's a bunch of answers, so I'm going to unpack a few that come to mind. Number one is the glucuronidation pathway. Glucuronidation is a pathway in the body where you take toxic substances and you break them down and conjugate them into less toxic substances. The problem is, because we're all eating food that has glyphosate residue in it, that's killing lactobacillus and other beneficial species of bacteria in the microbiome, which then allows the overgrowth of pathogenic bacteria like streptococcus and staph and klebsiella and pseudomonas. These pathogenic bacteria then raise an enzyme called beta-glucuronidase, which is an enzyme that inhibits that pathway. So you're literally putting a cork in the drain of this phase 2 detox pathway. You have a buildup of estrogen. So you have women with estrogen dominance. They have bad periods and PMS and breast tenderness. And that's all because of that pathway. So we can use things like calcium D-glucarate, which is glucaric acid bound to a calcium molecule, and you can inhibit that enzyme. You can use probiotics to inhibit that enzyme so that you can get that glucuronidation pathway working better. But the root cause is fixing the SIBO. So that's one big thing. And I think the other thing is just our buckets are full. We put mercury in our mouths in the form of silver fillings. We go out and eat glyphosate, or we drink wine contaminated with glyphosate. We have histamine issues. We don't ground ourselves to the earth. We're chronically stressed. We're surrounded by EMF, and people live next to cell phone towers.
Black pepper contains a compound called piperine, and this is just another plant toxin. And piperine inhibits UDP glucuronyl transferase, which is the enzyme used in the liver to put glucuronide onto compounds that you are trying to excrete via phase 2 detoxification. Herein lies the problem. If you are eating moldy food, or you are exposed to things that your body wants to detoxify with glucuronidation, and you eat black pepper, you are inhibiting or decreasing your body's ability to do that, the level of UDP glucuronyl transferase, curcumin being one of those. There are many others, and you're making this problem worse. And as Evan said, you're getting recirculation and enterohepatic recirculation of things like xenoestrogens or estrogens from the body, endogenous estrogens.